very grateful that you all have all come here. I will be a little fast with my presentation. It's not going to be too long. Therapy at its best, level 5 in prevention. So it is a prevention topic, and I'm sure that many of you, when you all saw this topic, may have said not again, right? Because you all must have been reminded about your Park and Park textbook of preventive and social medicine during your medical days. And don't worry, I'm going to be very little core of PSM and fairly a lot of day-to-day medicine in my presentation. So traditionally, we know that there are 3 levels of prevention. That there is primary prevention, which is intervening before the health effects occur. There is secondary prevention, that is screening to identify diseases at their earliest. And then there is tertiary prevention, where you manage the disease post-diagnosis to slow it or stop it. Right? So graphically, no disease, asymptomatic disease, clinical course, primary, secondary, and tertiary prevention. But there is 2 other classifications here, that you have primordial prevention, which is risk factor reduction targeting an entire population. So for example, everybody wears a mask so that nobody or as few people as possible get COVID, right? And quaternary prevention, which is at risk of over-medicalization. So they need protection from excess medicalization or new medical therapy invasion, and ensuring that they are treated in an ethical manner. So FOMO is an internet age nerdy slang, right? It stands for fear of missing out. And we are all human, and we miss out on some patients. No matter what, we might not pick up something. And then we also have the fear that it might go on to becoming a case. And then there is a judiciary and executive who are both trying to attempting to be highly logical. But in human affairs, where there is emotion and logic, there is always going to be a certain amount of error. So guidelines will always therefore be useful. They will help us to reduce mistakes, and they will help template future improvements. So choosing wisely came up with a list of top 5 recommendations. These 5 recommendations were: vitamin E, don't take a multivitamin E or beta carotene to prevent cardiovascular disease or cancer. Don't routinely perform prostate-specific antigen-based screening for prostate cancer. Don't use whole body scans for early tumor detection in asymptomatic patients. Don't use expensive medications when equally effective, lower-cost generic medication is available. And don't perform screening for cervical cancer in low-risk women aged 65 years or older, and in a woman who has had a total hysterectomy or a benign disease. For example, in prostate cancer, the conclusion was that it does not prevent cancer or major cardiovascular events. In fact, it may increase the risk of heart failure. Excessive vitamin E causes blood thinning and interferes with blood clotting. Excessive vitamin E is linked to higher risk of all-cause mortality. So what is the practice policy statement? Again, now this is for weight management, which is another screening. Obesity screening and diagnosis guidelines. Number of guidelines are available. Follow whichever suits your practice. There is a consensus across all guidelines, so most of them say the same thing. The BMI provides the most useful population level measure, but another very sensitive one is the increased waist circumference, which has a risk factor to prompt clinical intervention. Risk stratification that can predict increased mortality is an Edmonton obesity staging system, which can be useful in classifying those at risk. And only 20% of patients with obesity have an appropriate diagnosis or obesity management plan by their primary care physicians. So that's something which we can change. If the hip and or spine cannot be measured or interpreted, or if the patient has hyperparathyroidism, or if there is severe obesity over the weight, which is over the weight, which limits the DEXA scan from being done. Essentially, good screening guidelines are available. In the post-pandemic world where prices are skyrocketing and earnings are nosediving, screening can play a vital role in cost reduction without reduced diagnostic yield. We as family physicians can be the most effective source of cost reduction without quality compromise. Thank you.